everyone, Davonna here again with Mindful Reflections for 419 Education and Training. And so today I want to discuss the Piriformis Syndrome or the pain in the butt, right? So what I hate when I hear people say, oh, I have sciatica. And I'm like, who told you you have sciatica? Were you diagnosed with sciatica? Or do you just have a tight piriformis and it's causing you havoc, right? And so what I find in, the massage industry, especially, people are scared to touch the glutes. And so with anything, you have to get permission, right? So if you hear someone says they have back pain, chronic back pain, low back pain, and so the first thing in my mind is it has to be a glute issue, right? Piriformis, glute medius, QL, right? And so one of my clients, she used to call it like the piriformis pain in my butt syndrome, right? Because for her, she used to sit a lot. So she worked at the desk, she used to sit a lot, be on a lot of calls, and so she used to come in a lot with that issue. So of course you can do some stretches to help with that, to kind of loosen up the piriformis. Obviously, the best thing to do is a massage. You can strengthen, right, all the muscles around it, doing some, bridges, leg lifts, some strengthening exercises for the back. But if the piriformis is all knotted and locked up, because remember, it's really tiny, and so if it's super tight, it's just causing havoc. So a lot of times, just doing some nice muscle stripping and some myofascial release work, or even some cross fiber friction work to break it up helps. In my sessions that I with the piriformis issues, I use cups. So I will use cups on like glute medius area, glute med, as well as QL, and then strip using the cup. That used to kill people, but it gave them really good relief. So just some little tips. So if you hear people talking about they have some low back pain or some, around the glute area, just always think about glute, not glute med, but piriformis, but glute med is another one. Also, looking at someone's gait, right? So I'm a really big advocate for gait analysis and looking at how people walk. And so if you notice that their feet is turned out all the time, obviously that piriformis is on constantly because it's external rotation of the hips. So if the feet is out, it's constantly on. So that's going to really trigger that pain. So really help the person be mindful of keeping their feet straight while they're walking. I have to do it. I'm conscious of it because, my mom used to say I walk like a duck, or, it's because my feet was out. So I make a conscious effort. Plus, I'll feel it immediately. And so when my piriformis is tight, I'm immediately hopping on the foam roller, rolling out, also using my massage gun to kind of get at it if I can't get into massage or my massage is not coming up to like a week or so later. So just be mindful, really work that piriformis. Don't be scared to ask permission. And so, yeah. So looking forward to seeing you guys again next week. Please like and subscribe, and I will see you next time. Bye.